And I was just thinking of that story, and as much as we can, of course, congratulate and thank our doctors and our specialists, equally to congratulate is our nurses in this particular incident, just showcasing the need for nurses in this country, the role they play. So it brings me to this now. We will continue to observe International Nurses Day, and nurses around the world are being honored for their bravery. Now, nurses and other healthcare workers have been going the extra mile since the COVID-19 pandemic, and they've been at the forefront of attending to patients and risk being infected with the deadly virus themselves. Now, some of the colleagues and their colleagues lost the fight against COVID-19, but others have conquered and continue to combat the virus, this despite any challenges that are limiting them in terms of resources. So to discuss more about the significance of this day, Lerato Mthunzi joins us now, and she's the Young Nurses Indaba Trade Union's president. Thank you so much, Ms. Mthunzi, for your time. I mean, what's the significance of this day? When we reflect on the work that the nurses do as South Africans, how would you like us to commemorate this day?
I think first, let me say Revolutionary Nurses Day to all the nurses of South Africa and the nurses of the international world. I think the best way to really commemorate this day in 2001, post the pandemic, will be without fail to start caring for the carer. And as Young Nurses Indaba Trade Union, we've dubbed this year the year of caring for the carer deliberately, because we feel so strongly that at the pinnacle of this care, the very carers are in dire need of having the communities they serve, the employer they work for, and the government of the day caring for them. We've not seen this being demonstrated. You rightfully said a lot of our healthcare workers have lost the battle against COVID-19, and some with their families. And we would really like to go back to a point where truly our healthcare workers are not just commemorated with lip service to say we celebrate nurses, but when we are at the healthcare system that is ailing, we are not able to put the government of the day to account and make sure that at least we have the bare minimums as nurses on a daily basis to be able to continue giving service. And for us, to be very honest, the only way to truly commemorate us is to give us these weapons, these shields, for us to go into this war with confidence. As we speak, that is not the case.
Why do you think this is so? Because when we think about nurses and the sacrifices that they have made to the country in terms of responding to the outbreak, I mean, we could go on and on and on, but it seems that nurses themselves aren't empowered. When you look at some of the protests in the past we've seen in Limpopo, nurses saying they cannot work under these conditions, their shifts do not make sense. It seems, that wasn't attended to with the sense of urgency needed. When we look at the issue of remuneration, and I know that your union and your organization has been at the forefront trying to fight for what rightfully belongs to nurses in terms of resources and remuneration. It seems that call wasn't heeded with the urgency that it needs. Why do you think this is the case?
I think what we lack as a country is the political will. The political will to fix an ailing healthcare system. And this healthcare system was ailing even before the pandemic. And we just got a double whammy, to be honest, and we find ourselves in even a worse off position. So the political will is one thing. There isn't even transparency. Whether you speak about COVID-19 itself or even the vaccination, you find that it is difficult to get service providers who are healthcare workers, nurses particularly, supporting all the strategies put forward by the government, because there is no transparency, there is no information, and things are just, it's really a top-bottom type of situation. So really, to be honest, from where we sit, we would like to see more political will, but also there's serious a way in fighting this looting and corruption that is happening in the healthcare system.
Right.
And the only way to do that is to ensure we've got processes and systems that are working.
Before I let you go, healthcare workers were, of course, prioritized in terms of that phase one. In terms of the vaccination rollout program, it seems approximately only 400,000 healthcare workers have been vaccinated so far. Ms. Mthunzi, that's a drop in the ocean in as far as speediating that program. What would you like to see in terms of at least nurses receiving that jab and being further protected from this virus?
Look, I think what is important from where we stand is ensuring without fail that we at least, at the minimum, we are able to allow these healthcare workers that we speak about to actually have a buy-in. So what we failed to do was to deal with that perception where healthcare workers do not even trust the very government of the day with their own lives. It's a drop in an ocean, and it's not even going to achieve herd immunity that we want, we intended for it to achieve, simply because there isn't buy-in from the ground. So there's still a lot of work to be done in terms of achieving that, and we are hoping the government, for a change, post this Nurses Day, they're able to sit down with the service providers and really come up with strategies with clinicians and healthcare providers on the ground.
We'll leave it there. Thank you so much. Lerato Mthunzi, she's the Young Nurses Indaba Trade Union's president.